Hello, my name is Holly Brink, and as a future health service administrator, I'm going to be addressing diversity in healthcare as my professional presentation. My audience is fellow healthcare administrators within the organization that I work for. I'm going to share some information on what diversity in healthcare means, as well as some statistics on the importance of diversity within healthcare. Diversity in healthcare is when the healthcare provider is culturally competent, when he or she is able to deliver culturally appropriate and specifically tailored care to their patients with diverse values, beliefs, and behaviors. Being able to provide culturally competent care is an advocate strategy for reducing health disparities. I feel that diversity in healthcare improves patient satisfaction and patient results. We as health service administrators can help do this by having our patients' background understood and respected. When a healthcare provider understands a patient's unique background, they are in a better position to explain their test results and any diagnoses that have been detected. When patients feel that their provider represents them, they are more empowered to ask questions and more assertive. They're also more likely to follow their healthcare provider's advice, which in end result leads to better choices and outcome. While diversity is important in any field, it is extremely important within healthcare. Diversity comes in all different ages, races, religions, and genders. Therefore, as a healthcare administrator, it is so important for my office, my staff, and this organization to accommodate the diversity of our patients. Diversity in healthcare starts with us. It starts with our organization, our staff, our values, and our beliefs. Being a diverse organization allows our patients to feel welcomed and understood. Our patients and their care is our number one concern, and this makes them feel like a priority. Our diversity shows them this. Our representation puts patients at ease. When we recognize their cultural sensitivities and we are proactive about helping patients with personal and cultural practices, we are putting them at ease. Healthcare is not going anywhere, and the need to improve cultural diversity in healthcare is a constant. As America undergoes healthcare reform, it is important to consider what universal access means in a country undergoing significant demographic change. The patients that we are serving now will look very different from our patients in the future. If we do not have these cultural contexts of these people we are serving, we are not going to be as effective as healthcare professionals. Some current statistics that I would like to share with you are the average wait time for African Americans needing a kidney transplant is almost twice as long as that of white patients. African American women with breast cancer are 67% more likely to die from this disease than white women. The mortality rate for African American infants is almost 2.5 times greater than it is for white infants. Hispanics and African American youths are substantially more likely to die from diabetes than white youths. African Americans and Hispanic physicians are more likely to provide care to poor and those on Medicaid, and this also holds true for female physicians. Some of the statistics of the future of healthcare diversity that I would like to share with you are: in 2043, the so-called minority population is now going to be the majority within the United States. By 2060, nearly 1 in 3 Americans will be Hispanic. The Hispanic population will more than double to 128.8 million. The percentage of Black Americans will double, 34.4 million by 2060. The number of international migrants is expected to grow by 41.2 million. The U.S. population is aging. By 2060, the number of Americans aged 65 and over is expected to double to 92 million, and those that are 85 and older will make up 4.3%, which is 18.2% million of the overall population. These are all things that we need to consider on a day-to-day basis with our practice and organization. We shall strive to improve the quality of care and put our patients at ease by practicing a cultural diverse healthcare organization, by putting them and their background as a priority of culturally diverse staff.